Mariana Hernandez Aldama, and welcome to the Employer's Prescription for Employee Protection Toolkit, best practices for prescription drug benefit design. For more than 75 years, cancer care has been a trusted resource for cancer patients and their families, providing free professional support services, information, and financial assistance to help people manage the emotional, practical, and financial challenges of cancer. I myself am a cancer survivor. In January of 2014, my life was turned upside down. A routine blood test during fertility treatment was abnormal, and I heard the words, "Efforts to get pregnant are on hold for now. You have cancer, acute myeloid leukemia, an aggressive and fast-moving variant." I know personally what it's like to travel this frightening and confusing road. I ended up kicking cancer's butt after a life-saving bone marrow transplant. Thankfully, I had great insurance coverage. Health insurance is one of the most important benefits that companies provide their employees. However, purchasing or designing a benefits plan can be a complicated challenge for the employer. Cancer Care has created this toolkit to help corporate decision makers recognize some of the cost control practices that may have unintended consequences for employees and their families, especially those with life-threatening diagnoses such as cancer or other serious illnesses. Utilization Management, also known as is a collection of treatment review and cost reduction practices used by health insurers and health plans. Too often, utilization management results in unintended consequences for patients. For example, delays in care can result from denials of coverage for medications that physicians have deemed medically necessary. This interferes in the doctor-patient relationship by requiring that the doctor find an alternative to what they believed was the best choice. This may mean that the patient is denied access to recent therapeutic advances that precisely match treatments with the patient's specific illness. It can also result in patients having to pay costly out-of-pocket expenses for less effective treatments. Utilization management may also end up costing the employer more in the end. When an employee doesn't get the right medical care at the right time, they are more likely to need time off from work or be less productive as they strive to get better with less than optimal treatment. In the modules that follow, we'll discuss pre-authorization, formulary design, step therapy, copay accumulators, financial non-adherence, and quality-based value assessments. Let's take a look at the role of pharmacy benefits managers and the utilization management tools they use, which often come with unintended consequences that can truly harm your insured employees. PBMs aim to control drug costs in many ways, but unfortunately, their practices can also jeopardize patients' access to timely and effective care. PBMs control formularies, which is the list of drugs covered by a health plan. In theory, they organize formularies based on a drug's effectiveness, weighed against cost. In reality, PBMs negotiate directly with drug manufacturers to secure cashback rebates on drugs. In a sense, a bulk rate discount in exchange for a preferred spot on the formulary. However, these discounts don't always reach the patient, and the PBMs may pocket the rebates as profit. Then PBMs use various utilization management strategies to steer patients and prescribing doctors toward preferred drugs, which may not include the best drugs for a particular patient's condition and individual needs. These so-called cost-saving tools can come at a steep cost to employees, requiring them to jump through administrative hoops and pay higher out-of-pocket fees to access essential prescriptions. Suffice it to say, for those employees and their family members who face cancer or other serious conditions, the structure of the benefits package that your company chooses is critically important. Unfortunately, despite their best intentions, many companies end up with benefits packages that include numerous utilization management tools as a way to lower costs. While the short-term savings are appealing, there are often costly long-term consequences that can actually increase healthcare costs while reducing employee morale, retention, productivity, and quality of life. A strong benefit design is a win for both employees and employers. it can help attract and retain talented employees. In fact, 60% of employees named healthcare as the most important benefit when considering a job offer. For employees who face serious illness, a strong health plan can help shorten the road to recovery and support their return to work. To learn more about how utilization management can affect patients, please refer to the booklet Best Practices for Prescription Drug Benefit Design, available at cancercare.org, and view the other videos in this series.